Radiotherapy can cause side effects in the area of your body that's being treated. You may also get some general side effects. After treatment finishes, it may be 1 to 2 weeks before side effects start getting better. After this, most side effects usually slowly go away.
People can get side effects just after the first treatment, potentially. It depends how big a dose that we're giving, for example, and how long the course might be. But I mean, the commonest thing which kicks in quickly is fatigue. People feel a bit tired and washed out. That's partially due to radiation, partially due to the travelling. There's a lot of travelling back and forth. And some people might be on other treatments like chemotherapy, for example. But in the vast majority of cases, it's mild and manageable. So the occasional patient will feel really tired and washed out, and that can last for a few days sometimes. At worst, a couple of weeks. But as with anything with radiotherapy, it always settles down, but sometimes it can take a little while.
Tiredness is a common side effect, which may last up to 2 months after treatment. Try to get plenty of rest and pace yourself. Balance this with some physical activity, such as going for a short walk.
With the modern radiotherapy techniques, skin effects are much lower than we've ever seen in the past. Again, because the way the radiotherapy is delivered, it's delivered in an arc, going round in a big circle, so the skin dose is spread out. So the doses we get to the skin are very, very minimal usually. So at worst, usually people might get a little bit of pinkening in an area of the skin where the actual radiotherapy was aimed, and they might get a bit of dryness and itchiness. But in terms of red raw, we never see that these days. It's not going to happen. You're just going to get, at worst, a little bit of itchiness.
Do not put anything on your skin without checking with your specialist or radiographer first. Have a cool or warm shower rather than a bath, and turn the spray away from the treated area. Pat the area dry gently, do not rub. Wear loose clothing that is less likely to irritate your skin, and avoid exposing the treated skin to the sun for at least a year after treatment has finished.
The gullet can be affected by radiotherapy to the thorax, so that mainly affects patients who've got central tumours or where we're treating lymph glands in the centre of the chest. So if they do get a sore gullet, most of the time it's mild and just take some mild painkillers. Occasionally people will get really quite sore and need to take stronger painkillers, even sometimes morphine. That sometimes is required to people that get a very severe, what we call an esophagitis. It gets better, it's self-limiting, it'll go away, it might last a few weeks. What I normally suggest is, avoid spicy foods. If you're struggling with solids, if things feel like they're getting stuck, you might want to try and use foods that are actually high calorie, so you keep your calories up so you don't lose weight, but are easy to get down. Again, the main thing to get across, if you do get this, it will settle down. It might take some time. Take painkillers if you need them. So some people hate taking painkillers, but actually why suffer when you can have medications that can help? And that's a key thing, to get back in contact with us. If people are having symptoms, don't grin and bear it. Don't sit at home in pain. If you're struggling, ring up. We'd much rather be called than not called, because we want to help out early. It's easier to treat you if we get to it earlier than later on.
You may experience pain or discomfort when swallowing. You may also get heartburn or indigestion. Your doctor can prescribe medicines to help reduce these symptoms. If you are having difficulty eating, then you can replace meals with nutritious high-calorie drinks.
There are what we call late effects from radiation, so most people have settled what we call the acute side effects within the first 6 weeks. A few patients, probably about 10%, can get a flare-up of long-term problems further down the line. The one that usually crops up first, if it does occur, is what's called radiation pneumonitis, which is a lung inflammation. That usually occurs between 2 and 10 months after radiotherapy and manifests itself as a dry cough and breathlessness. Can be quite frightening for patients. They think, oh crikey, this is the same symptoms as I had when I presented with lung cancer. Is the lung cancer coming back? But invariably it's due to the radiation inflammation. If it's mild, it doesn't need any treatment. It will settle after a few weeks on its own. However, if you get quite breathless with an irritating cough, we can give a course of steroids to settle it down. So that's one of the things we get. And another possibility a bit further down the line is actually getting sort of airway obstructions. We can sometimes get strictures of the main airways, tightening of the tubes That's quite rare these days, but that would manifest again as a cough. Sometimes coughing up blood, again, can cause patients to be quite frightened. It might be the cancer coming back. The way to diagnose that is to actually have a camera down to have a look, but fortunately that's quite a rare side effect to get a stricture. And the same thing can happen to the gullet. Rarely you can actually get a stricture of the gullet. Again, I rarely see these things in clinic these days because the radiotherapy techniques tend to avoid all those sorts of problems. But occasionally we still see a case, so it's important to let patients know that if they get problems, get to us, and then we can investigate and work out whether that is indeed the problem that's going on.
Inflammation or scarring of the treated area of the lung can cause breathlessness or a cough. Narrowing of the gullet means you could continue to have difficulty swallowing. There is also a slight increase in the risk of heart problems, which may cause tightness or pain in the chest. And you can also experience pain in the chest following the thinning of the bones in this area. Your radiotherapy team will explain what to expect and give you advice on managing your side effects. Always tell them about your side effects. There are usually things we can do to help.
Listen to your body. So I often say to some of the patients, if you have an afternoon nap, it might just be a bit 5-10 minutes longer. Just have your afternoon nap if that's what happens. And if there's a day where you don't feel like going out, don't necessarily go out that day, but try and the next day do a little bit more each day as you recover. But the vast majority of people can carry on. In fact, patients, some of the patients are still working, and I say to patients, actually see how you go. You can still go to work and do work if you're still working. If you've got a very physical job, that might be more tricky. It's an individual thing. So sometimes people would feel that they're going to work and they're just exhausted. So it's very important they talk to their employer to say, look, I'm having radiotherapy, I'm going to see how I go, but I might have to take some time off if I struggle. And some people fly through, others do have to take some time off. It's just very variable.
Please visit the Northern Radiotherapy Network website if you have any questions or queries.